So if we're doing a deadlift, commonly we would do a conventional deadlift where we're kind of deadlifting with this bar here. Hey there, revivers. Welcome back to our YouTube channel. I'm Dr. Preston Nguyen, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist. In today's video, we'll be discussing tips and tricks for all of you weightlifting beginners, or those of you who are looking to get into strength training. So let's get to it. I often get a lot of patients who injure themselves weightlifting. Most of the time, we go from a sedentary position, either working at a computer, sitting behind a desk, driving, or using a phone or mobile device, to lifting increasingly heavier weights at the gym. Our bodies begin to adapt to whatever position or posturing we've been holding for a long time. As a result, what is supposed to be normal body mechanics is no longer efficient due to poor postural adaptations. The most common ones we run into are rounded shoulders, forward head posturing with an anterior pelvic tilt. Having this type of posturing puts your body in a compromised position even before you pick up a weight or attempt to do any type of compound movement involving two or more joints. The two main things I'll be going over later in this video are how to align your body properly starting from the feet, joint by joint, all the way up to the head, and how to perform a proper hip hinge, which is an element crucial to virtually any compound movement involving the upper and lower body. Now we're going to go over proper standing posture starting from the feet, joint by joint, all the way up to the neck. So for your feet, you're going to want to feel your big toe, pinky toe, and heel pressing into the floor. You don't have to grip them into the floor, but that's where you want to feel the floor pushing up against you. The next joint is your knees. Your knees, you never really want to lock them out. You want them to have a slight bend in them, and you want them to feel bouncy. Okay. The next joint up is your pelvis. This is an anterior pelvic tilt I was talking about earlier in the video, and we don't want to go into that forward flex position. Conversely, a posterior pelvic tilt is basically when your hip drops back, and that's going in the other direction. Both of these at the extreme are not correct. What you'll want to do is go in between them and kind of find where your pelvis naturally rests. That is your neutral position. That can also change over time. The next joint up is going to be your rib cage and how that sits over your pelvis. So in order to check this, you just take your pinky and your thumb. This distance is going to be specific to each individual, and that's going to measure the distance between your belly button, which is where I place my pinky, and the thumb, which goes at the bottom of your xiphoid process, which is where your two rib cage bones meet at the sternum. If you have to overextend your pinky and your thumb, that means that your rib cage is too opened up over your pelvis. If you have to crunch your pinky and your thumb, that means that you are too forward flexed. Okay, the next joint up is going to be your shoulders. For this, all you have to do is shrug straight up, turn your palms out, or externally rotate your shoulders and drop them down. And that should be a proper setting position for your shoulders. The last position is going to be your neck. Your ears should be in line with your shoulders. So most of us are going to be in this position. So once we set those shoulders, we're going to actually want to chin tuck or draw our head straight back. And that is a proper standing posturing. So now we're going to demonstrate a proper hip hinge. This is going to simulate a bar you commonly see at the gym. So if we're doing a deadlift, commonly we would do a conventional deadlift where we're kind of deadlifting with this bar here and we're kind of extending up. And then this bar would simulate kind of a back squat when we're here and we're back squatting. But those are for later videos. What we're gonna do is actually use this stick and go over what exactly a hip hinge is. So for this stick, you're gonna wanna place it on your back, touching your tailbone, and the tip of the stick should also be touching your head and in between your shoulder blades. What you're going to do here is keep this stick against all of those areas, and you're going to basically bend at the hip. This is because of the relationship between your hip and your hamstrings. What we don't want to see is as I roll forward, this hip gets away from my lower back and I start rounding at the back. This is going to be very detrimental once you start squatting and deadlifting, or if you're just picking up any object off the ground. Conversely, I do not want to come down and see the gap between the stick and my neck as well. Another way you can use this stick to check your proper hip hinge is keeping it right at that pelvic line And as I bend forward, I should be compressing the stick between my thighs and essentially my abdomen. And that's how you know you're doing a correct hip hinge. All right, and there you have it. Now you know how to properly align your bodies in a standing position. This applies to both standing and posturing in general, but it's especially important before you go in and add weights during strength training. Hip hinging, again, is a vital component to understand and be able to perform naturally so that you not only protect your spine, but so that you can engage the proper muscles in the correct sequence. Stay tuned for more workout tips and tricks in the upcoming videos of this series on how to properly work out and strength train.